Today's episode is brought to you by Bush's Fresh Food Market. Calling all foodies, Bush's is hiring. Are you passionate about food, looking for growth, development, and excellent wages? Come grow with Bush's and apply online at bushes.com/join our team. That's Bush's, BUSCHS.com/join our team.
From the Detroit Free Press, I'm Emma Stein with today's Free Press Voice Briefing. It's Tuesday, August 16th, 2022.
This is Lily Altavino with the Detroit Free Press. Detroit community members and parents say children face significant barriers in getting the treatment they need for asthma. There's also growing concern over climate change's health impacts on children and rising cases of asthma in Detroit children. According to the Michigan Department of Health and Human Services, childhood asthma rates in Detroit are higher than the rest of the state. That is a disparity that did not exist in 2014. The rate of asthma in children in Detroit is 14.6%, up from 11.3% in 2014, according to the state's most recent data. Statewide, 8.4% of children have asthma. The disease disproportionately affects Black Detroiters, the data shows. Air quality in Detroit, specifically in areas with higher poverty rates, has also raised concern over persistent asthma among children.
This is Christina Hall with the Detroit Free Press. Michigan public health leaders say monkeypox is not limited to the LGBTQ community, and they hope to avoid that kind of stigma with the current outbreak. More than 11,000 people in the U.S., including 99 in Michigan, have been diagnosed with monkeypox as of Monday, according to the U.S. Centers for Disease Control and Prevention. The vast majority who've contracted the virus are gay and bisexual men, though cases also have been identified in others, including women and children, says the Director of Infectious Diseases Research at Beaumont Health. Cases in Michigan have quadrupled in less than 3 weeks. Doctors told the Free Press it's likely many more people have the virus who are not yet tested. Some say the U.S. response to the outbreak has been too slow, as access to testing, supply of vaccines, and treatments remain limited. Michigan has received 7,600 vials of the Jynneos vaccine, which is authorized to prevent both smallpox and monkeypox or limit symptoms after exposure. As of August 10th, nearly 1,300 doses had been administered, though there is a lag in reporting. The state also received hundreds of doses of tecovirimat, the antiviral drug sold under the brand name TPOXX. As the vaccine arrives in Michigan, doses are being delivered to hubs established at health departments in Oakland, Washtenaw, Kent, Kalamazoo, Grand Traverse, Ingham, St. Clair, Bay, and Marquette counties, as well as the District Health Department 10 in the northwestern Lower Peninsula and Wayne State University's STI clinic. The outbreak also brings back difficult memories of the stigma of the 1980s and 90s that were associated with HIV and AIDS for many in the LGBTQ community. An infectious disease doctor at the Detroit Medical Center and director of the Wayne State University Adult HIV Program says this outbreak re-stigmatizes members of the LGBTQ community and gives the rest of the country a false sense of security. She says while monkeypox is not necessarily a sexually transmitted disease, it is passing between sexual networks, and no sexual network is closed.
I'm Andrew Hammond for the Free Press Sports Department. Michigan State football is about 3 weeks away from the official start of game week against Western Michigan on Friday, September 2nd. So that means this is the second week of fall camp for the Spartans, and it's all about getting a little bit better on both sides of the ball. As head coach Mel Tucker points out, Jalen Berger and Peyton Thorne are among the group of players that stood out in last Friday's close scrimmage.
I was pleased with the way we ran the ball. You know, at times with some guys, Berger was about 5 yards a pop, and he was running behind his pass. He was falling forward on contact, which is good. Had really good, traffic burst, through the hole, and showed really good vision and ran hard. Peyton was efficient and competed well. DJ Barker showed up and was very productive in the opportunities that he did have. Ben Van Sumeren is really coming on. He had a good spring and he's really starting. The last couple of days of last week was really starting to play well, and he carried that over and had quite a bit of production. So, there's quite a few guys that are playing well. I mean, Xavier Henderson is very consistent. He's playing fast. His speeds are up on a consistent basis, based upon the numbers that we get off of the units.
For more stories from the Detroit Free Press, be sure to check out freep.com. That's FREEP.com. I'll see you tomorrow.